Hi friends, welcome back to Smile Nursing tutorial. Last we have discussed about the phototherapy. Next, we will know about another procedure like cardiopulmonary resuscitation. First, what is cardiopulmonary resuscitation? A artificial ventilation accompanied by cardiac massage to facilitate normal breathing and heart action in the event of cardiac arrest. Coming to the purpose to re-establish effective ventilation and circulation during the cardiopulmonary resuscitation. To give this resuscitation, we should need some equipment. Now, we will see one by one. Cardiac board, suction apparatus, oxygen supply, box containing AMBU bag, sterile endotracheal tube that is 2.5 and 5.5 mm sizes, extra batteries, laryngoscope with size 0, 1 and 2, tongue blades and stillet, Magil forceps, adhesive scissors, airway, syringes 1 cc, 2 cc, 5 and 10 cc, intracardiac needle 20 gauge, 22 gauge, 6 to 8 cm length, needles 23 gauge and 20 gauge, elastoplast bandage. So these are guidelines for selection of laryngoscope, endotracheal tube and suction catheters according to the age. In premature infant, we will use the laryngoscope Miller 0. Endotracheal tube size is 2.5 and 3. Uncuffed. Distance means 8 cm. Suction catheter is 5 at 6 sizes. In term infant, laryngoscope is Miller 0 to 1 with Hippel 1. Endotracheal tube size is 3.0 and 3.5 uncupped. Distance in centimeters mid-trachea to teeth or gums, that is 9 to 10. Suction catheter is 6 to 8. For 6 months baby, endotracheal tube is 3.5 to 4.0 uncuffed. Distance is 10 centimeters and suction catheter is 8. For 1 year baby, laryngoscope is with Hippel 11 by 24, Robert Shaw 1 and endotracheal tube is 0, 4.5 uncuffed. Distance mid-trachea to teeth is 11 cm. Suction catheter is 8. So, like that, according to the patient age, laryngoscope and endotracheal size, distance centimeters mid-trachea to teeth and gums and suction catheter should be arranged. While giving this resuscitation, we need to know some general instructions. We have to identify red flag, signs of critically ill child changes in level of consciousness, flaccid posturing, cyanosis, severe chest retractions, grunting respirations, increased respiratory rate, shallow respiration. We have to see SAW respiration, that is abdominal protrusion with inhalation, irregular respirations with periodic deep signs, apnea, absent pulse, absent heart rate, absent carotid pulse, dilated pupils, unrecordable blood pressure, cold and clammy skin. So these are the general instructions we have to observe while giving the CPR. We have to act quickly. Why? Because child can go into cerebral hypoxia within 3 to 4 minutes, which will lead to permanent brain damage. We have to assess the child, look, listen, feel. So, if not breathing, call for help. Immediately start cardiopulmonary resuscitation. Now, coming to the procedure, airway. We have to establish patent airway by suctioning oropharynx with catheter and deflate stomach by aspiration stomach contents. Next, is it clear? Okay, coming to the breathing. We have to establish breathing by artificial ventilation. Place AMBU bag on mouth and nose and connect to 100% oxygen. Select ET tube using the formula, that is A's in ears plus 4 by 4. Calculate size of ET tube approximately as diameter of child's little finger. The U2 tube is inserted to a distance calculated using the formula ET size into 3 centimeters. Next, coming to the circulation, initiate cardiac compression method. Serial rhythmic compression of chest that help to circulate oxygen containing blood to the vital organs. In infant, side sternum, compression below level of infant's nipples, width 1 finger, breadth, depth 1 by 2 inches to 1 inch, rate 100 times per minute. Coming to the child, that age is 1 to 8 years, sight is lower margin of child's rib cage to notch where ribs and sternum meet. Avoid compression over notch. Place heel of nurse's hand over lower half of sternum between nipple line and notch. Depth is 1 inch to 1.5 inches. Rate is 80 to 100 times per minute. Ratio of cardio compression to ventilation. 2% is 5:1, 1% is 15:2. Coming to the child above 8 years. Adult method is used for external cardiac compression. Depth is 1.5 to 2 inches depth. Rate is about 60 to 80 compression per minute. We have to assess the vital signs of the child, and compression must be followed until the patient starts spontaneous respiration and pulse. Next, drugs used in emergency. It is very important. We should keep some emergency drugs and also should know about the drugs which are used in CPR. Next, coming to the administration of drugs. Injection epinephrine, that is adrenaline, that everybody knows. Initial IV or intravenous dose is 0.01 ml per kg, that is 1:100 dilutions, or 0.1 ml per kg, that is 1:10,000 dilutions. Doses as high as 0.2 mg per kg may be beneficial. Adrenaline administration to be repeated every 3 to 5 minutes during resuscitation. Next important drug is sodium bicarbonate, 8.4% solution, 2 to 4 ml per kg body weight. This has to be diluted with equal amount of any IV fluid. Next, atropine sulfate, 0.02 mg per kg with a minimum dose of 0.1 mg for child and 1 mg of adolescent. This dose may be repeated after 5 minutes. Maximum dose is 1 mg for child, 2 mg for adolescent. Next, coming to the calcium chloride, 10%. 5 to 7 mg per kg of elemental calcium, that is 0.2 to 0.25 ml per kg. Calcium will deliver 5 to 7 mg per kg elemental calcium. Slow IV infusion should be given. Next, prostaglandin E, 0.05 to 0.10 mg per kg. Next, dopamine, 2 to 20 mg per kg per minute through infusion pump. Drug used in pediatric advanced life support. So, today we have discussed about the cardiopulmonary resuscitation, general instructions and the procedure. Next, we have seen the drugs which are used in emergency. Thank you for watching video. If you like, share, subscribe.